Hi, I'm Lisa Costa-Bir and we're at the 8th Annual NIIM Symposium 2023 in Melbourne. And with us we have the amazing Dr. Helena Popovic. Hello.
Hello.
Welcome to FX Medicine.
Thank you very much for inviting me.
Now you just delivered the most engaging presentation that I saw. Everyone was up dancing around and jumping around. Can you tell our audience a little bit about what you presented on?
Well, the reason you saw them dancing around was because one of my messages is that a dance a day keeps dementia away. But the bigger picture of it all is I just wrote a book about can adventure prevent dementia? Spoiler alert, it can. A guide to outwitting Alzheimer's. And that came from the fact that 13 years ago when Mum passed away with lung cancer, I discovered a box of rivastigmine, brand name Exelon, in my parents' butter compartment of their fridge. And it is a medication that is a cholinesterase inhibitor, so it reduces the breakdown of a neurotransmitter called acetylcholine, and it's sometimes given in the early stages of Alzheimer's to temporarily slow progression of symptoms. It doesn't modify the disease and it doesn't work for everyone. But here's the thing, I didn't know anyone with Alzheimer's, so I asked my dad, who are these medications for? And he says to me, oh, your mother said they'd be good for my memory. So, you know, as long as, I don't think they do anything much, but as long as I stick a patch on every night, happy wife, peaceful life. That is how I discovered that my father had been diagnosed with Alzheimer's, because of the stigma. You know, such had been, you know, I had interpreted, I'd noticed he was forgetful and confused, and yes, he was depressed and withdrawn, but I just thought that's just grief at having just lost Mum. When I tracked down Dad's GP, the diagnosis was confirmed. And then I realised there was such stigma in my family of origin that my parents hadn't even told their only child, their devoted daughter, who also happened to be a doctor, that her father had Alzheimer's. And Mum hadn't even told Dad because his mother had Alzheimer's. She died from it, and he'd said if he were ever diagnosed, he'd throw himself off the Gap, which are the cliffs at Watson's Bay in eastern Sydney, and neither Mum nor I were prepared to call his bluff. And that's because it was a recent 2021 study in the United States, 150,000 men, average age 75, a recent diagnosis of dementia, which meant in the last 2 years increased suicide risk by 42%, increased the risk of, and if you had a diagnosis of MCI, mild cognitive impairment, increased suicide risk by 73%. Why? Because unfortunately too many health professionals, even neurologists and geriatricians, are still telling people diagnose and adios. In other words, get your affairs in order, there's nothing we can do. And things will only get worse. This is so outdated, inaccurate and unacceptable because, and I know your listeners know this, just because something doesn't come in a pill doesn't mean it isn't powerful. We know that sleep, stress management, food, exercise, mental stimulation, social connections, music are medicine for our mind. So my key messages are, you know, people are more powerful than pills. Our relationships are the most important thing in keeping us healthy. Our decisions are more powerful than our DNA because all our lifestyle habits have an epigenetic effect, and especially in dementia, education is more powerful than medication. So they were my key messages on how adventure can prevent dementia.
Wow, so powerful. Now, tell me about exercise, because look at these guns of yours. Amazing. I couldn't keep my eyes off them when you were doing your presentation. Tell us a little bit more about exercise and BNDF, because that was really, really good too.
Okay, well, firstly, you know, everyone sort of knows, oh, yeah, I should exercise. But people don't realise just how important it is for the brain. I think everyone's talking about the gut-brain connection. We need to start a bigger conversation about the muscle-brain connection as well. Whenever we move our muscles in any capacity, they produce a cocktail, like hundreds of chemicals called myokines, which circulate in our blood to all our organs to keep them in optimal working condition, particularly our brain. Now, whenever we either engage in aerobic exercise or strength training, our brain produces that chemical BDNF, brain-derived neurotrophic factor, which actually stimulates the growth of new brain cells and new connections between existing brain cells. And in the US, they're actually kids before their exams, they are strongly encouraged to either go for a run, a brisk walk, a swim, a cycle, half an hour. You know, within an hour of their exams, they perform measurably better. and just half an hour of as intense as you can physical exercise cuts our lifetime risk of dementia. Now, that isn't as big a surprise to most people as is the fact that strong muscles equate to a strong mind. I test every patient's hand grip strength. Easy thing to do. You can get it off Amazon at $30, a hand grip tester. And that's because hand grip strength, assuming you haven't had recent arm surgery, tends to reflect overall muscle strength. And overall muscle strength actually parallels brain strength. The stronger your muscles, the stronger your cognition, the stronger your mind, the better your memory. You know, this has just been found in study after study. So as we lose muscle, we also lose brain. And people, you know, get panicked, but I don't want to go to the gym, I don't want to lift weights. You don't have to. Just, number one, get one of those stress balls and just squeeze that. That will strengthen your, not just your hand grip, it'll strengthen your whole arm. And for some reason, it seems to have a cross-training effect on your whole body. So you can just start with something simple, just squeezing that stress ball every day while you're watching TV, whatever, you know, whenever you're just sitting around. Secondly, it is really important to do some kind of bigger muscle training. So just doing squats at home. Go to the internet just watch hundreds of free strength training exercises using your body weight. Ideally, go to the gym, get a personal trainer or an exercise physiologist, but it doesn't have to be complicated. So, from our mid-30s onwards, we lose at least 0.5% of our muscle mass every year, at least 5% per decade, most people 7 to 8% per decade. So between the ages of 35 and 75, we can lose more than 1/5 of our muscle mass. That is really significant. It increases falls and frailty for a start, but people don't realise that loss of muscle increases their risk of dementia substantially.
Wow, so many good bits of info there. Now, I know you've got a couple of books out and I think you've probably whet the appetite for us to want to know more. Where can our listeners find out more about what you've written and everything you've said today?
All right, go to drhelenapopovic.com. That's my overall website. And then you've got two choices. It'll ask you, do you want to prevent dementia? And it'll take you to the dementia website. Do you want to shed excess body fat without dieting or deprivation? And it'll take you to that, because most people know what to eat. The problem is not what, the problem is why and how we eat. So my book is Neuroslimming in that department, and it is about how to shed excess body fat without dieting or deprivation by using neuroplasticity, changing your brain, eliminating cravings, recognising non-hungry eating. Because let's face it, people eat when they're sad, angry, bored, lonely, in love, out of love, a myriad of reasons other than hunger. And that's when we eat the unhealthy food. If you've just had a terrible breakup or argument with your boyfriend, are you going to eat a plate of Brussels sprouts? No. You're going to go through that tub of ice cream or that packet of Tim Tams. So this is about how to learn to manage our emotions without food, among other things. So that's the other one. That's one book. And the other focus of mine is preventing dementia, and I've written 2 books on that topic. But I just want to finish with one really important point, that our attitude to ageing plays a really important role. And study after study has shown that if you've got a negative attitude towards ageing and you're focusing on all your aches and pains and how life gets worse, you will die 7.5 years earlier on average than somebody who is positive about ageing and focuses on what they're gaining. Freedom, not having a boss anymore, being able to do what I want with my time, wisdom, experience. Those people live 7.5 years longer than the complainers, which is great news, because it means you don't have to worry about all those whinges in your life. They'll be dead long before you. But, and there's study after study showing that just focus on older people that inspire you, rather than, that narrative about, oh yeah, life sucks when you age. I hate the anti-aging culture because it teaches people that aging is a bad thing. Aging is a great thing, because what's the alternative? Dying young. So I congratulate all my patients. I for reaching the age they've reached. We need to celebrate aging. So the first step in aging better is to feel better about aging.
Totally agree. Wow, that was fantastic. Thank you. Thanks everyone for joining us. Don't forget to check out our socials and visit our website for more infographics, podcasts and written articles. I'm Lisa Costa-Bir. We'll see you next time.